Matthew Holt with the Healthcare Blog, another quick THCB spotlight. I have with me Phil Fasano, who I knew quite a few years ago when he was, how do I say, CIO at Kaiser? I can't remember your exact role.
I
Ran,
was actually.
ran technology at Kaiser Permanente, a small non-profit health plan in the East Bay of California. I'm kidding. The huge and most famous integrated care system in America. After that, Phil left and went to an insurance company, AIG, and is now back in healthcare. So, Phil, you're these days the CEO of Recuro Health. So let's quickly start with your journey. How long were you at Kaiser, and what were you doing at Kaiser? Give me sort of this is at the time when Health Connect and the Epic installation was going. Tell me a bit about your role and what got achieved there, because it was quite a lot.
Well, a little bit. I went to Kaiser when it was starting the journey on implementing its medical record system and Epic, and I think that's been pretty widely written about and was a substantial success for the organization. It was more expensive, I think, than most of us thought it would cost, but it was substantially successful for them, and we used it as the basis to do everything, including do some digital healthcare capabilities that we created very early on when digital health was new. And that ended up being quite successful as well. It was important to me that we did that work with a view toward both being sustainable at it and being high quality and delivering great care and access. And I think it delivered on all of those metrics for the company. And I know someone mentioned to me during COVID they were doing 47,000 visits a day on that technology, which is for us that had moved on from the company. It's a proud moment to hear that, and I know the organization's done phenomenal things in health IT since.
Yeah, and they've actually been, I mean, since the sort of the layer that was put in by you, and by the way, the other folks who did well at that were our friends in Wisconsin who took that triumph and took it to the rest of American healthcare and are still, converting health systems to Epic. But I think that they've built a lot more on top of that stuff, including sort of, going to the home and doing a lot of other work, and it's a really interesting system. So you went off to AIG and ran technology there for a while, and then tell me about your journey back into healthcare.
Well, I've been doing a couple of things since leaving AIG. One of them is, as I said, I mentioned to you, I've been investing for myself in a number of startup companies, many of them in the healthcare sector, some of them in pure technology, and others in security. And I chose those three spaces to be focused on in my post corporate life. And I do still serve on a number of boards of directors. And my path to Recuro was via a board I've been serving on now for 3 years. I was asked to join the board about 3 years ago, just shortly after the company was formed. And then from the board, I was asked by the board of directors if I would become chairman and CEO, and agreed to do that last summer. And
Okay.
it's been quite a
Let, let,
journey since.
Great. Let's talk about that. So Recuro was founded a few years back. Michael Gordon, who was actually the original founder of Teladoc, all right, was I think the founder or one of the founders, right?
He was the
Obviously,
founder.
and a number of pieces came together, I think, in Recuro. But for those who don't know about Recuro, it has, that sort of telehealth roots. But to describe what is the current state of offering, what does Recuro do now?
I describe us to anyone who will listen as a care delivery system. And the way we approach care delivery is in the areas that we deliver care in: primary care, urgent care, behavioral health are the three focal points for us. We also have partnerships that allow us to extend that and deliver laboratory capabilities and genomic capabilities, as well as deliver pharmaceuticals through our partners. So people can get any prescriptions they need delivered to their home as well. It's a fairly comprehensive set of services, and it's well integrated. And our members tend to really enjoy the convenience and the service.
So tell me a bit about who you're selling it to. So we've heard a lot. I mean, there's a lot of different flavors of telehealth. There's the Teladocs in the American world who've done various different things. There's a lot of specialty telehealth companies who just deal with asthma or just deal with obesity or just deal with, you know, over-the-counter meds or whatever. Not over-the-counter meds. I'm talking about, talking about the hims and hers and the rose of the world. But you're taking a somewhat different approach. You're much more on the sort of, whole of primary care. When you're building that out, who are you taking to? Who are you selling it to? Who are the customers, and then who are the actual users, members?
Sure. And one thing I'll say is what we are not is we are not retail healthcare.
Okay,
So you
you're
can't go
not
to our
Hims, you're not
website.
Row. Yeah, I get it.
No, you can't go to our website and have a physician visit, but you can become a member of ours through an employer, usually, And the way employers come to us is through effectively the mid-market, which is what we sell to. We're not selling to the biggest companies in the world, but we're selling to some fairly sizable companies and smaller companies. And we do that through our relationships with brokers and TPAs in the aggregator side of the business. We also do it through direct sales into care systems and payers and providing organizations where we develop relationships, and they need an organization like ours to augment their core capabilities. And then membership joins us. We have over 1 million members at this point, and we're growing quite rapidly as well as with respect to our membership. So our services are bought commercially, delivered to members individually and members and their families, and then they have access to our services through either our mobile capabilities, mobile app capabilities, or the telephone to access our physicians and our care system.
So there's a lot of discussion now about, people going to employers with point solutions for just mental health or just this or just that, I'm on the program at the moment via Blue Shield bizarrely for one of the MSK companies. There's all these different pieces, right? And there's a lot of discussion about, well, is that too confusing? Do we need a more comprehensive from primary care to, Glenn Tillman's running around, but transparent to talk about delivering sort of integrated care across all these things and not a point solution. Give me a sense about how you think that market is playing out, especially for those mid-market employers who probably didn't have anything like this before.
Yeah, many of them can actually buy any piece of us. So if they want to buy urgent care, if they want to buy behavioral health, and that's the piece of our organization that they'd like to leverage and use and make accessible to their employees and our members, we'll do that for them. So we'll custom bundle in any way they like. So they can buy it all the services that we offer, or they can buy any single piece of it. And we have customers that do that. We believe you're as a customer and with respect to patients and members, they're better off buying primary care, urgent care, and behavioral health because we want to treat the whole patient, and we want to help that patient be healthier, deal with any mental health issues that they may feel challenged with, and provide them the access that they really need to be able to leverage those services reasonably well and conveniently for them, as well as deliver great levels of quality service and capability for them.
So if you think about, this distinction between point solutions / primary care slash the mess that is specialty care in America. Obviously, coming from the background at Kaiser, you had a very different system. But for most Americans, we know all the money is spent in specialty care. We know there's very little coordination between primary care, if it exists, and specialty care. A lot of people have been getting into primary care and getting their fingers burnt. A bunch of big retailers we know of Walmart particularly has pulled out, but it's always a big question as to how well that works. What do you see in the market, and then where do you think we are nationally in kind of fixing this problem? If the Kaiser type approach is a good one, which I mean, obviously we're both bought into that, but you don't see that anywhere else. As I said, outside of small parts of California and Hawaii and elsewhere. Where do you see that current sort of state of play, and how do you think Recuro is playing in that sort of management of that specialty care realm?
Sure, and then I'll just say it this way: while we don't offer specialty care directly, and we do not have bricks and mortar, we do view ourselves as a health system. And to us, that means the primary care physician is the quarterback and has the ability from a population care standpoint to see the patient end to end in our systems and the health information that we have on the patients. But they also have the ability to refer that patient to any specialist that's necessary. We have broad relationships with specialty care groups across the country. And those handoffs, because we have a great clinical ops team, are warm handoffs where we're managing both the handoff itself and the patient's access so that we're delivering a high level of accessibility to care, even when it's not directly being provided by our people.
So given that, what are some of the early outcomes here, or outcomes both in sort of inequality measures and cost measures? A lot of people have said, yes, we can do this and we can bring down the cost. It's hard to do that on a sustained basis. But what are you seeing so far?
Well, we're a small organization still, so we're growing. So I can't speak in large populations. I can speak in 1.5 million members. but I can't speak on behalf of tens of millions and hundreds of millions of people. But with respect to us, I can, looking at specific members and customers of ours, we've actually returned for certain organizations $4 or $5 on every dollar they're spending with us because we're delivering a high quality level of care with access and a continuity of care and care management that's part of what we do to enhance the patient's journey inside the health system and across the health system, which ultimately translates into better health, uh, active care management across chronic conditions, and the ability to deliver just a better level of care for that patient on an individual basis, a one-off basis. Every human being is different, and therefore needs to have that custom level of attention. We're able to provide that, and my hope is we'll be able to provide that at 3 or 4 million members as well.
And then just on the sort of practicality, so if you come into a new customer, right, and you say, hey, we now have this, we now have a virtual care platform, which is going to be primary care. How do you and your customers and whoever you're working with persuade people to say you should try this approach to primary care rather than going to whoever you've been going to before, or if people just not been going before and it's usually a sort of a new thing but a welcome thing. What do you think the flavor is out there in terms of how the behavior change required to think about using this kind of a video and digital approach as opposed to what people have always done?
Interesting question. I'll use an example to answer you. Working with, I'm going to pick on a health system, I won't name them, but we do have health systems as customers. They obviously have physicians of their own and they deliver great care in their communities. Working with a particular health system that I'm thinking of that is a customer of ours, they came to Recuro, and the problem they were trying to solve was outside of their city. Their patient population didn't have the access they needed. So they wanted to come to us and leverage our digital health services to provide for the patients that we're not getting the kind of access that they thought they should be getting. That was the hypothesis. The way it turned out is that we actually offered the ability to get into our mobile capabilities and have the patient choose a visit with either one of their primary care doctors, who might have a 2 or 3 week wait, or to see one of our primary care doctors tomorrow or today. And oftentimes they'll choose one of our primary care doctors because they just want to be seen, and they have something they want to discuss with that physician. Oftentimes they'll choose to wait, and that was up to the member and the patient. So what we all discovered together is that we were actually moving the needle on their quality goals beyond what anyone anticipated at the start of the relationship. And they've now doubled that relationship with us in terms of membership as a consequence of the performance we've had together. We actually blend quite well with community-based care and primary care in areas that across the country.
So, two last questions. I'll ask the last one about Recuro and sort of some of the operational, the dynamics of the business. But the sort of last general question is, push this out. Okay, Recuro, you want to go from 1 million change members to 3 to 4. Obviously, there are other organizations trying to do this virtual primary care, and we're building out, the understanding slowly since the pandemic that you can do great work virtually, and you can do a sort of more comprehensive care management piece. And CMS is coming in and starting to think about paying for digital therapeutics and remote monitoring, and what you've called right now care. How do you think this plays out over the next 5 years? Do you think that this will become something that's much more generally known and accepted? Is it going to stay a niche and just become a bigger niche? Do you think it's going to run into a roadblock of the big health system saying, we can't, this is cutting into our into our margins and we don't like it? How do you think it's going to play out?
I believe that digital care is healthcare. I don't think there's a distinction between the two. And I think it's up to the industry to deliver great care and access for everyone who needs it and everyone who wants it. I think the challenge the entire industry is having right now is that even when they're focused on delivering high quality, affordable care, they're struggling with having enough physicians and ability to provide access to those physicians. So as a consequence, digital care, I think, and one of my hypotheses is, and I think it's a strong one, and I think it's been pretty proven, we provide great access and we augment the services of the physical system in a way that actually is symbiotic between the two, improving quality of care, improving health outcomes, improving for the government payer the value that's being delivered by the whole system across all the government metrics that are being pushed out, and improving reimbursement for the system itself. I mentioned 4 to 1, 5 to 1 earlier, and that's exactly what I'm speaking to with that metric. They're spending $1 with us; they're getting $4 or $5 back, for the value they're creating as a system. And I think that, as a consequence, there's real value for everybody. Both the patient's healthier, the system is performing better, and everyone should be happier and feel that we can get access when we need it. I call digital health, I always did, concierge care, yeah, without the expense of the current concierge models, and they tend to be pretty closed systems. I think concierge care for everyone is what digital health is, and it should, harmonize the entire access challenge the system has if we all do our jobs right.
That's a small if, but there we go. All right. Lastly, just tell me about Recuro. You raised, I think you said 70 odd million over time. And how long before you got there? How long's the company been around? Give me a sense of the scale. You mentioned some of the big offerings. I know there's some other parts of what you do. Just give me a sense of how many people there are. Give me a sense of the company.
Sure. I mean, we have somewhere around 500 physicians. We're, in terms of employees, we're probably 120 people now. So not a large group of people doing quite a lot of work. And we'll continue to grow. We continue to add people. We're one of those companies in this space that's actually hiring rather than laying people off. So we feel pretty good about that. It is great. You have to run a disciplined organization, and we do. And we believe we'll be very sustainable as a consequence because we are profitable as well. All that said, it really, we're an organization that's focused on, the people that we care for the most. And I think that's what really drives all of us and the services that we've put together.
You said just an add on that. You said you mentioned before you became profitable this year. You're now at $1 million and change. If I was a big, and there are people who, as you know, there are people with big checkbooks around who are interested in doing things. If I'm a big PE company, could I come on, give you on board, give you a big check and get you to looking after 10 or 20 million people in the next couple of years? Is that an option on the table you consider, or do you think the only way to do this is to grow, $1 million or $2 million a year?
Well, we're growing a lot more than in terms of membership. We do believe that you have to organically prove that you can grow, and
right.
We are growing quite substantially. You also have to prove that you can manage the business part of this, which is what the profitability metric does. Beyond that, we have aspirations to grow much more rapidly than we're growing, and that does require cash and a vision for where you want to operate and potentially acquire other assets that can augment what you do. And we're in the midst of formulating that strategy right now. So during the end of summer, we should have a fairly firm strategy about what parts of the country we want to dip into and what kind of capital we'll need to go and make acquisitions to the extent that we're going to be doing that.
Interesting stuff. Well, I look forward to coming back and hearing more about that when it happens. I've been talking with Phil Fasano. He's the CEO of Recuro Health. Phil, thanks for your time.
It's my pleasure. Nice to see you, Matt.